Does your foot hurt here or does it hurt here? Has your doctor told you you have plantar fasciitis? Let's take a minute and make sure. I want you to take your sock and shoe off. And now for the first one, what I'd like you to do is to push on your heel. You're going to be off to the side and about an inch up from the bottom. Dig in right there real hard with your finger. Then the next spot, I want you to go at about the peak of the arch. It's almost to the side of your foot, and push really hard right there. Now, which one hurts? If it hurts here, it's plantar fasciitis. If it hurts here, it's posterior tibialis tendinitis. Now, of course, it could hurt in both places because you could have both. But let's talk about what you do for plantar fasciitis. Many doctors and therapists debate the success or failure of treatment for plantar fasciitis. I've been using the same protocol for almost 20 years, and I've had more success than is reported in the literature. Now, some things you can't do at home, like laser or iontophoresis, so you'd have to come into the physical therapy clinic for that. But there are some things that you can do for yourself. The first and most important thing is to check your shoes. If you're wearing shoes that fold in half or are flexible like this, then changing this one thing could be all you need. Wear only shoes that meet these criteria. They bend only where your foot bends, which is at the toes, and cannot be wrung out like a dish rag. Should have a slight heel with a shock-absorbing sole. Here's a few more examples. Then get yourself some arch support, preferably a custom semi-rigid one. If you don't want custom, then do this when shopping for the arch support. Sit down and hold the over-the-counter orthotic up to the bottom of your foot with your foot relaxed and your toe slightly pointed. See if the curves match. Choose the one that matches best. Many of these you can't open the packaging, which makes it impossible, but shoe stores will have some that you can. Now to the hard part. Wear shoes and arch supports at all times, meaning never go barefoot, until your pain is greatly reduced. Then you can start trying barefoot. But if your pain starts to come back, go rush and put your shoes and your arch supports back on. Now here's the part where I'm going to say some things that are all over the internet. Stretch your calf and Achilles, hold it 30 seconds, do it twice a day. But add this, stretch before you stand up. That means stretch before you get out of bed, stretch before you stand after a movie or a long drive, and so on. This is because when your foot's at rest and slightly pointed, the inflamed plantar fascia tightens. Then when you put your full body weight on it, it can cause little tears or microtrauma to the plantar fascia. This then perpetuates your problem. The next thing is, don't do all those exercises on the internet for plantar fasciitis yet. Hold off on those heel rises and the foot muscle strengthening until your pain is down to at least a 3 out of 10. If you can also hold off on running and other things that make it worse until it gets better, then slowly, meaning start with only 5 minutes, I know that's a short amount of time, return to your walking, running, aerobics, dance, or what have you. Increase by 5 minutes a week until you get to where you want to be. After you exercise, ice the bottom of your foot with the ankle bent in dorsiflexion, like the image I'm showing here. Do this for 10 minutes after exercise or after a long day on your feet. The other things you can try on your own is massage. Massage the bottom of your foot with your hands or a tennis ball or maybe a rolling pin. Massage until the massage hurts less. This pushes the toxins out of the area. Now, some of you may have been diagnosed with a heel spur, or maybe you're just afraid you have one. The heel spur does not actually stick straight down into the ground. I know that's what it feels like, but it's actually parallel to the bottom of your foot and looks like this. In summary, wear shoes that only bend at the toes, arch support, stretch before you stand, and ice after activity. I hope this helps. Subscribe to our YouTube channel for more helpful videos by clicking on the button on your screen. You can also see our videos from our Facebook page, Google page, or our website.